Aminat Medical Monologue, empowering healthier lives through trust. A woman walks into a clinic for a routine cervical screening. She feels completely healthy, no pain, no unusual symptoms, nothing that makes her think something could be wrong with her. So then her testing results come back. High risk HPV, human papillomavirus, is detected. She looks shocked and asks, "Doctor, how can I have a virus when I feel completely fine?" And that is exactly why we need to talk about HPV, human papillomavirus. And you can have HPV and not know it. In fact, HPV is extremely common, and many infections cause no symptoms and clear naturally. But when certain high-risk types persist, they can cause abnormal cell change and over time lead to cancer. Yes, I said it, cancer. So here's my question. Could you have HPV without knowing it? And could a vaccine help protect you from several cancer caused by HPV? Stay with me. You need to stay with me because what I'm about to explain could change the way you think about this virus. Okay? It could change everything you ever knew about this virus. So, hello everyone. Welcome back to the channel. I'm Dr. Aminat, and this is your trusted home for evidence-based medical education, where we simplify medicine and empower healthier lives. Okay? Here we separate the medical facts from the myths, answer health questions people are often afraid to ask, and give you practical information to help protect yourselves and the people you love. So if you are new here, welcome. Please subscribe and turn on your notifications so you never miss a video. It is very important. So stay with me until the end because today we're going to talk about what HPV is, how it spreads, symptoms, genital warts, HPV and cancer, myths, testing, treatment, prevention, and HPV vaccine. Yes, there is a vaccine. Now let's talk about HPV. What exactly is HPV? Okay, HPV stands for human papillomavirus. But here's something many people don't realize. HPV is not just one virus. It is a large family of viruses. So some HPV types can cause warts. Other types are considered high risk because persistent infection with them can cause certain cancer. And here's the part I want you to remember. Having HPV does not automatically mean you have cancer. No. Let me say that again. HPV does not equal cancer. Most HPV infections clear naturally without causing serious health problems. The concern is when certain high-risk HPV infections persist over time. That is where the problem is. Now let's separate them. There's the low-risk HPV and the high-risk HPV. So think of HPV as a large family and not every member of that family behaves the same way. And that's true. Some types are called the low-risk HPV. These are commonly associated with genital warts and are not the types that usually cause cancer. Then we have the high-risk HPV. These types can cause changes in cells. If a high-risk infection persists for years, some abnormal cells can change eventually and develop into cancer. HPV is linked to cancer of the cervix, of the vulva, the vagina, the penis, the anus, and parts of the throat. Yes, the throat. In fact, most all cervical cancers are linked to high-risk HPV infection. But remember, HPV infection is common, and cancer is not the inevitable outcome. So, persistence of the high-risk HPV is the major concern here. So, stay tuned. Now, let's answer one of the biggest questions. How do you get HPV? HPV spreads through intimate skin-to-skin contact. It can be transmitted through vaginal, anal, or oral sex. And here's something important. A person can transmit HPV infection even when they have no visible signs, no warts, no pain, no warning signs at all. This is one of the reasons HPV is so common. And no, HPV is not the same virus as HIV. HPV is not herpes. They are actually different viral infections. So who is at risk of having HPV? Here's something I really want people to understand. HPV is not a disease of bad people. It's not a proof that someone is dirty, and it's not something that should automatically create shame for people. I know there's a lot of misconception about this. And HPV is extremely common. And if you've had intimate sexual contact, exposure is possible. And because HPV remains unnoticed, people may not even know they have acquired infection. So let's remove shame and focus on health. Let's focus on testing. Let's focus on screening, vaccination, and also prevention. That exactly is where the conversation should be. So what are the symptoms of HPV? Let's talk about that. Here's a surprising answer. Many HPV infections cause no symptoms at all. Nothing. You have no signs at all. No what? Nothing. You may feel completely healthy and still have HPV. Some HPV types can cause genital warts. This may appear as small bumps or groups of bumps in the genital area, and then you think it's just ingrown hairs. Please go get tested. But high-risk HPV infection may cause no obvious symptoms while cell changes are developing. Okay? Cell changes are developing and no symptoms. And that is exactly why cervical screening is so important. You do not wait until you feel sick before thinking about prevention. You need to go get checked as soon as possible. So now let me talk about HPV and cancer, because I know that this is where a lot of people have a lot of misconception. And this is the part that scares a lot of people, scares many people out there. Someone hears HPV test is positive and immediately they think, oh, I have cancer. No, that is not true. You have to stop. You have to take the information one step at a time. Okay? A positive HPV test does not automatically mean you have cancer. Most infections resolve naturally. Okay? But persistent infection with high-risk HPV types can cause abnormal cells to develop. And over time, some of the abnormal cells may become cancer. So that is a stage by stage. Without treatment will lead to cancer. HPV can cause cancer of the cervix and is also associated with cancer of the anus, the penis, the vulva, the vagina, the oropharynx, which is the back of the throat, including areas such as the base of the tongue and also the tonsils. So the goal is not to panic. The goal is prevention and early detection. So now we'll play our favorite game, separating the myths from the facts. You know what time it is, myths or facts. So 1, if I have HPV, I definitely have cancer. Wrong. Most HPV infections do not lead to cancer. Okay, so let's get that straightened out. Next one, if I don't have genital warts, I don't have HPV. That's wrong again. Many HPV infections cause no symptoms, especially the high-risk HPV. Another one I hear every time is only women get HPV. That is absolutely false. HPV affects both men and women. Okay? Another thing is HPV vaccine treats an HPV infection I already have. Oh no. The vaccine helps prevent new HPV infection. It does not treat an existing HPV infection. Okay? And if I've had HPV vaccine, I never need cervical screening. No, dear. You always need your cervical screening. Vaccinated people should still follow recommended cervical screening guidance. Okay? The vaccination and the screening is good together to help you to prevent and treat yourself and protect yourself against HPV. So now, how do doctors test for HPV? This is where I need to make an important distinction. HPV testing is used as part of cervical cancer screening depending on your age, country, your medical history, and local guidelines. So cervical screening may involve an HPV test, a pap test, also a cytology, or a combination of tests. A pap test looks for abnormal changes in cervical cells, and HPV test looks for high-risk HPV types linked to cervical cancer. So you can see that they are quite different. And screening recommendations are not identical in every country. So you have to follow the screening programs and medical guidance where you live. So you need to see your primary care physician to educate you on that. And yes, even if you receive the HPV vaccine, cervical screening still matters. It still matters. So you asked the question, can HPV be treated? This question is extremely important because this is a question that a lot of people are waiting to get answers to know exactly, is HPV treatable? Is there a medicine that simply removes HPV from the body? That's another question. But currently, there is no specific treatment that simply eliminates the HPV infection itself. In many people, the immune system clears infection naturally from the patient's system, but doctors can treat the health problems caused by HPV, also known as human papillomavirus. Okay? So genital warts can be treated, and precancerous cervical changes can be monitored or treated. HPV-related cancer can also be treated, especially when detected early. When it's detected early, that's why it's good for screening and diagnosis, early screening and diagnosis. So please don't buy random medications online claiming to flush HPV out of your body. That's not true. Okay, you need to get proper medical advice. Now let's go to the main thing, prevention, HPV vaccine. Now we need to talk about one of our most powerful prevention tool, which is the vaccine. It's our powerful prevention tool. The HPV vaccine helps protect against HPV types that commonly cause cancer. Okay, because you never can know who have it, so you have to prevent it and also protect yourself. And here's something people often misunderstand: the vaccine works best before exposure to HPV. That is why vaccination is routinely recommended in early adolescence. So under current CDC recommendation, routine vaccination is recommended at ages 11 or 12 and can begin at age 9. So catch-up vaccine is recommended through age 26 for people who were not adequately vaccinated. For some adults, age 27 to 45, vaccinations may be considered through shared clinical decision-making with the healthcare professional. So you need to see your healthcare professional. So recommendations and schedules can differ by different countries. So check your national immunization guidelines. And let me make this very clear. The HPV vaccine prevents new infections. It does not treat an HPV infection that is already present. So, but vaccination can provide powerful protection against future infections from vaccine-covered HPV types. So now let's ask, why vaccinate children that are so young? This is one of the biggest questions that parents actually ask in the hospital. And why do they ask this? And the doctor, they will like, doctor, why does my child need an HPV vaccine at 9, 11, or 12? And I'm going to answer this for you. The answer is just prevention. Okay, the answer is prevention. Vaccine works best when given before exposure to the virus. The goal is to build protection early, long before the person may ever encounter HPV. Okay, it's like you going to the gym starting at a young age and then you get muscles later to fight off infection. So think about a seatbelt. You don't wait until the accident is happening before putting it on. You put it on before anything like that. So prevention works best before exposure. HPV vaccine is cancer prevention, and that is why we recommend it to everyone. So how can you reduce your risk? How can you protect yourself? Get the HPV vaccine if you are eligible under your local recommendations. So you have to see your primary care physician. Attend cervical screening when recommended. Need to attend cervical screening when recommended. Use condoms correctly and consistently. They can reduce the risk of HPV transmission, although they do not provide complete protection because HPV can infect skin not covered by a condom. So you need to take that into consideration. Talk openly with your healthcare provider about your sexual health. That is very, very, very important. You need to give them all the information. And if you receive an abnormal screening result, please follow up. Don't disappear because you are afraid. Don't assume the worst. Okay? Don't assume the worst. Follow-up is how we identify changes early and decide what needs to happen next. What is the next way to treat this? And then one more thing is, if there is one message I want you to remember today, it is HPV is common. It can be silent. And having HPV does not automatically mean you have cancer. But persistent infection with certain high-risk HPV types can cause serious health problems that you don't want. That is why vaccination matters, screening matters, follow-up matters, and prevention matters. Okay? Don't let fear stop you from protecting your future health. I know we're all scared, but you need to understand that you have to take the information in step by step and then go on to treatment. So knowledge gives you choices, and early action can save lives. I want you to always have that in mind. Okay? Go for screening. Don't run away. Don't disappear. So thank you so much for watching, for staying, keep giving me your time to listen to me. And if this video taught you something new, please like, subscribe, and share it with someone you care about. And I have a question for you. Before watching this video, did you know that HPV can cause certain cancers in both men and women? Please leave your answers in the comment section. Tell me in the comment section, please. Let me know. Write it down in the comment section. I'm Dr. Aminat, and remember, knowledge saves lives. Prevention protects future. Stay informed, stay healthy, and I'll see you in my next video. Bye. Aminat Medical Monologue, empowering healthier lives through trust.